think my favorite part about working with my patients is getting to know them, getting to know what's important to them, and then being able to take that to come up with an individualized treatment plan, to come up with a plan for how that impacts a patient's care. That looks different for every individual person, and I'm privileged to be able to have those conversations with my patients. There are a lot of things that makes oncology unique as a specialty. You get to walk with patients through some really critical times in their lives and really get a sense of what is important to an individual person and how we can help them meet their goals. We get to be central to their care. We get to be sort of the lifeline throughout their care, coordinating all the different things that are going on in this person's life and being someone to reach out to. The relationships with my patients are really important to me and are central to how I try to care for them. I came to medicine by way of biomedical science. I spent a lot of my time as a researcher in the lab. I really was yearning for a way to apply those findings in a more practical way and take some of the really groundbreaking stuff coming from the lab back to patients and really see those findings be applied in the clinic and change people's lives. And I use mainly computational techniques. And what I look at is how the tumor cells in someone's cancer interact with the normal cells, immune cells, and other parts of people's normal tissues, and how that impacts cancer development, cancer growth, and cancer spread from one organ to another. I think access to clinical trials is one of the big assets that we can offer a patient. Of course, when I see a patient in the clinic, we always discuss what the current standard of care is. And that's the care that you can get at any center and should always be discussed. But cancer care is a rapidly evolving field. There's always something new on the horizon. I'm eager to discuss clinical trials because it offers a chance that there may be something better than what we can offer otherwise. That's an individual choice for an individual patient, whether they want to enroll in clinical trials. But I'm very fortunate to have a lot of opportunities to discuss those things with patients. I spent a lot of time looking at data from patients' tumors. I spent a lot of time looking at tumor samples from patients who come to our cancer center and trying to learn new things about how the cancer interacts with the rest of that patient's body. And ultimately, I hope that those will lead to improvements in cancer care. That'll come first through laboratory findings, like what I work on, and subsequently we hope it'll translate into early phase clinical trials, which we're able to conduct here, which will tell us if what we've learned is going to impact the way patients are cared for in the future. In the past 10 or 15 years, we've seen a couple of things really revolutionize cancer care in certain fields. Immunotherapy is one that springs to mind. Genetically engineered immune cells reinfused into patients has transformed the care of a lot of blood cancers. Some of those revolutions, some of those big changes have not made their way into all cancer types. And there are certain tumor types that have proven very resistant to some of our newest therapies. I think one of the most exciting things is finding a way to bring advances that have already transformed areas of oncology care, to bring those to new tumor types and to bring those to new groups of patients. There's a lot of good to be done for a lot of people, and there's a lot of improvement to be made. As a medical oncologist here at Siteman Cancer Center, I'm very happy to walk alongside a patient along their cancer care, both from all the way from diagnosis to staging and treatment, and ultimately to survivorship. And I look forward to talking with my patients in a few decades and learning about everything else that life held for them.